Well, I think the untenable and unaffordable costs of care are going to have a major impact. It's actually, I think it may be either at the tipping point or beyond the tipping point. People can just not afford healthcare, and this is not 10 or 20 million people who don't have health insurance. I'm talking about the majority of working Americans and their families and people in retirement. I think we're going to see that pressure really, really surface, and the need is there. So you have this. It's not like people don't need healthcare. People need healthcare, and they can't afford it. And I think that's going to be a bigger crisis than we have imagined or have experienced to date. I also, and in response to that, I think what we're going to see is the further consumerization and retailization of healthcare. I think there's going to be tremendous pressures on the federal government, which is again Medicare, Medicaid, 40% of payment. I think you're going to see tremendous pressure on the other major payer, which are employers. Those pressures are the regulatory requirements now for employers to be fiduciary responsible for their health care benefits has increased. Most people are not even aware of the regulations that have been imposed on employers. So I think you're going to see that cost pressure and that affordability pressure really, really hitting providers and hospitals. And then you're going to see a response from the retail space. I think the retailization of healthcare is a very, very real thing. Again, you don't, the new entrants, the relatively new entrants, they don't have to transform healthcare. They just have to make it better than what exists today. And yeah.
Amen.